Hi guys, welcome back to my YouTube channel for our fellow subscribers, and if you're new, welcome. So today I'm with a guest, Dr. Mutasa over here. We are going to share with you guys how to get through the MDPCZ exam, or at least how we managed to pass the board exam. So Dr. Mutasa is going to give us an overview of what this whole board exam is about as we dive into how we actually passed subject by subject, or should I say,
It's subject by subject, right?
Mm-hmm.
So, whenever you studied abroad and you want to come back to work in Zimbabwe, you have to go through the council assessment, which is the exam, as held by the medical and dental practitioners of Zimbabwe. We abbreviate it as MDPCZ, whatever that one, right?
MDPCZ, yeah.
MDPCZ, yeah. So, it's structured in a way that they want to make sure that your medical degree that you actually have outside the country is going to be like legit in the country. So you have to undergo a council assessment, which is done in March, June, and October. So in this council assessment, they'll be asking you about 4 major topics, which is surgery, internal medicine, pediatrics, obstetrics, and gynecology. So it's important to know that you write all the examinations in one day. I'm talking about surgery, internal medicine, pediatrics, and obs and gyne. It's all written in one day. So the first and second examinations are going to be 30 minutes apart, for the most part. Like you write the first examination, most is going to be like an hour long. All examinations are 1 hour long, right? You're going to have like a 30 minutes break between the first and the second examination, and then you write the second one. The order depends on the council, whatever order they choose at that time. Between the second examination and third examination, there's kind of a long break, about 2 hours. And then the third and fourth examination, again, they're going to be like 30 minutes different. And I think you have to come with a full stomach, because you'll be writing examinations from 9 a.m. all the way to around 5 p.m.
Mm-hmm.
Yeah, all for examinations. There's nothing like you're going to write medicine on Monday, and then maybe after like 2 days you write surgery. No, every examination is written on the same day. So the material for study can be quite difficult to get a hold of, right? Which is why me and Dr. Tari are here to kind of tell you, let you know how we actually pass examinations. We're gonna tell you about the material that we used and the methods that we kind of use, tricks.
Tips.
Yeah, let's just say
yeah.
tips and tricks that we kind of use to actually conquer this examination. I call them conquering. Oh, and guys, MDPCZ examinations can be really hard.
Very hard. Not to discourage you guys, but it's doable. You know, we did it, and we are here to testify and help you guys make it in your journey too.
And I think an examination that I passed, anyone can pass.
Don't say that, because he's super smart. You have to study a lot, know almost everything. Yeah, okay, not almost everything, but you have to know a lot of things.
I mean, like, basically medicine, you're expected to know everything, but we know that it's impossible. So you have to know most of the stuff.
Mm-hmm. And know the important things. So here we're going to guide you guys so that you get to know what is actually important, what to actually focus on. To begin with, a giveaway for those that are going to leave halfway, though I encourage you guys to get to the end. I did a lot of questions, past exam papers. So if you can get hold of those, please do. Those will help you. Because for example, I can study a certain topic, you can study diabetes, and you think you know everything about it. You've studied it inside out. But when you actually try to answer one of their questions on it, that's when you realize like, I think I was reading the wrong textbook.
It's like group discussions help a lot, because similar to say that you have to do many questions because you might have studied diabetes and you think you know everything. The same can happen actually for study groups. You might have studied diabetes and you think you know everything, until Dr. Tari comes and tell you some facts about diabetes that you never knew. And that's when study groups come in handy. And also sometimes it might be overwhelming for you to study, let's say, the whole of cardiology, right? It's quite broad, it's a huge topic, right? So maybe you can assign each other topics to say, okay, Dr. Tari, you're gonna do valvular diseases, and Dr. Blessing, you're gonna do cardiomyopathies, and so on, so that you actually come together and present the topics to each other and actually come up with something, so you don't have to go back home and study the whole valvular diseases. And sometimes just listening is kind of an easy way to actually get something. And some people like Tari are good teachers and explainers of conditions. Yeah, so
I'm
it's
flattered.
quite, you know this already, isn't it? You always know this. So yeah, I think it's quite important that you join some group studies, but it depends on people. Some people prefer to study alone. If that works for you, then go ahead. But for me, group studies help a lot for me. Like it did help me a lot.
Yes. I would dive right into surgery because surgery group discussions help me a lot. I told you guys like you need to do past exam questions, but the past exam questions for University of Zimbabwe students, surgery, the ones that are called S1, S2, my goodness, they used to get me so depressed. I just did not know how to go through them alone. So the only time I would actually go through those papers was when I was doing group discussions or they assigned me 5 questions and I would go and do just those 5 questions. Because believe me, you'd have to search almost all books to find those answers. And sometimes you wouldn't even find the answers.
Exactly.
That's why now you need to know that you need books, different books. I used Zeno Notes, that was one. I also used SRB, there was Bailey and Love. And then there's also a part of orthopedics and they have ortho bullets for it. It's like a short book again. And there was also an anesthesia book because they also have ANA questions in the exams.
Yeah.
So I don't know, what did you find helpful in surgery?
So one thing that you gotta know first about the surgery examination is the fact that it is negative marked, like negatively marked. So it's something that they call negative marking. So I don't know if you're aware of this. Like for every question that you get wrong, you get a minus, and for every one that you get right, you get a plus. So if you don't attempt a question, you get a 0. Does it make sense? So if you if let's say out of 10, if you get 5 correct and you get 5 wrong, then you basically have a 0.
Exactly. Because for each one you get wrong, it's -1. So you get 5 things wrong.
And then you get 5 things
correct.
Uh-huh.
You've got -5 and +5.
Then
0.
that 0 we did math.
But if you actually leave the 5 things blank and you get 5 things correct, you actually have a 5.
Yeah, so that it's sometimes safer to actually leave out the questions that you have no idea about. And for me, what actually helped me in surgery was the orientation that I did in surgery. The best thing about surgery, the general surgery part, is that what you see in the ward is actually what counts in the examination. Mm-hmm. And surgery questions are usually more direct. You don't need to think so much. If you see yourself thinking sometimes, it just means you don't know it. I mean, that's a fact. Sometimes, like if you find yourself thinking about something, you probably have never seen it. So it's better just not answer that question for some time. And also answer the question that you are really sure of, and also answer questions that are obvious. So for me, I only answered questions that I was kind of sure of and they were kind of obvious for me, and that's what worked for me. Questions that I never knew about, let's say there came a question about ENT. I knew nothing about ENT. I never studied ENT like that deep. So when I saw the ENT question, I didn't spend time going through the answers. The questions about ENT, I skipped go to number 5. If it was number 5, I go to number 6 straight away. No need to read the question that I never studied about, because I know that I know nothing. If I'm going to write anything there, I'm going to make myself fail.
Well, for me in that case, I saw the ENT question. I did decide to read through the questions, guys, because you know there is that thing where certain things are obviously wrong. Like for example, okay, I won't give an example because you know some things are just so obvious, but you just read through it and you're like, okay, this is definitely wrong.
Yeah, exactly.
And then you just put your false. Oh, that's the thing. You get one question and they gave you like maybe 5 options, 5 statements, A, B, C, D, E, and you have to be saying whether it's true or false. So for each thing you get a mark. So sometimes you read through something, you realize like, there is no way on earth this statement can be correct. I know I haven't studied this topic, but this is definitely wrong. So if you find such obvious questions, make the most of them because they're not a lot.
Yeah. So I think the elephant in the room is out, right? Like we kicked out the big stressor, surgery.
Yeah.
Now we go to what I think is the next stressor, internal medicine. I call internal medicine the beast. I personally think internal medicine is worse than surgery at some point. I don't know, what's your opinion?
Yeah, well, I don't know.
I mean, because internal medicine, you have to know like everything. I studied in China, right? So when we were in China, you'd go to cardiology department and focus only on cardiology. You're not thinking about renal conditions. Then maybe after a month, you go to nephrology, then you now focus only on nephrology. But in our setting, it's not the case. You go to medicine, right, to the medicine department. This patient is a cardiology patient, and then the next bed is actually renal. The next bed is, let's say, SLE, some autoimmune condition. So if you're not used to that kind of setting, you kind of get like a lot of confusion because you're not prepared to see all those kind of stuff. So which actually made the medical examination quite tough. I would say that from my experience, orientation does not help in medicine preparation. What is going to help you is doing a lot of textbooks. Talking about like questions, let me say questions from Oxford Assessment, a lot of EMQs, all this kind of stuff. That's what's going to help, because you can't, to be honest, you can't really finish the whole of medicine. Like studying everything is almost impossible. So a lot of questions are going to help you like get your work right.
Yeah, and for me, orientation helped me because I used to study, go back to the registrar and ask questions, guys.
Yeah, you can do that too.
They are willing to teach people who are willing to study. That is if you decide to go for orientation. So sometimes if a DKA patient is going to ask you questions on DKA. Yeah. So the kind of questions they ask you kind of prepare you for the exam. Like, okay, if they're going to give you an exam question on DKA, this is diabetic ketoacidosis. These are the kind of questions they ask. But also when you go through your past papers, you will find a question on DKA you don't know how to answer. You can always go to the fellow junior doctors and registrar and, you know, ask them what they think the answer is and why, and they will help you out. That was the major ticket for me. And that's how I busted internal medicine, with help, a lot of help.
And also you have to put that in mind, like you have to put in mind that they can ask you literally anything. When I say anything, I mean anything. And they can sometimes not ask you what you expect. For example, the exam that I wrote, 2 medicine examinations, they're consecutive. There was no HIV question. And I was shocked. I was expecting a lot of HIV because that's our society. Like we have a lot of HIV cases here. But to my surprise, there was no HIV question at all. But for some reason, there was a lot of SLE, there's a lot of like autoimmune conditions, things that you might have never seen in your whole life, or maybe some other bosses have never seen in your life, but that's what came in the examination. So yeah, I mean, if you take her advice, you'll be great. You'll be good.
Now we can dive into obstetrics and gynecology.
Yeah.
Well, what I can start by saying is that you just need to study.
Yeah.
You need to study. And one of the things that helped me was the past papers, maybe. And going for the orientation, I managed to see patients, chemo patients, and in my exam, they actually did ask for chemo drugs. And because I had seen them being handled and I had read through it as well, it was easier for me to, you know, actually respond to those questions. But the exam paper, you guys, it was difficult. The final exam. I remember I answered my questions, and when I go to number 34, I was thinking, I'm like, God, is this where I put my pen down and say I give up? Because I was literally cracking my head, thinking hard for every single question. But well, by God's grace, I actually passed. So you know what? Just study, do the papers, and God will see you through. Always pray.
And I think that Obs and Gyn is also one of the practical subjects. Like she said, when she saw in the word chemotherapy patients, she kind of helped her like actually answer questions in the exam, because there's a difference between knowing something theoretically and actually knowing something practically. You tend to remember things that you did practically more than the stuff that you read theoretically. So if you get a chance to go for orientation, I think you should, in Obs, it'll help you a lot. You come up with especially like those marked sulfate, what you call like preeclampsia, stuff like that. You have a lot of those cases. Treatment is going to be like on your fingertips. But also, like you say, the examination may come with something different. Like the last examination for OBS, it came up with some anatomy questions that I never thought would come. Asking us about the cause of the urethra. Is it the urethra? Like, who would have thought about that? Like, literally, because you're focusing on like things that you actually see in the word. Like, not even one like professor gonna ask like, what happened to the urethra or something. Like, no one is gonna ask you that.
That's why you need to do past exam questions, and also talk to people that have done exams before, because they have a lot of insight.
Like Dr. Tjandra.
And there are a lot of other people that are out there. I'm sure you can always, you know, get in touch, like Dr. Mtasa over here, and a whole lot of other guys. You should try and join actually a WhatsApp group that is made up of, foreign trained interns, you know? Yeah. And there you also get people revising past papers together, discussing questions.
Online.
That is very helpful.
Yeah. And now we dive into the last department. Is it the last one?
Mm-hmm.
Yeah, pediatric babies. Those cute little beings. So that department also, I find it to be really practical. What you see in the word is actually what you see in the examination. And the big way to actually pass, like the best way to pass Paediatrics, the one that I found, do all pediatrics papers. Let me just say that. All of them, you gotta do them. All of them. You're gonna find about, like the last examination I did, I think I found about 18 questions from my past exam paper.
I think pediatrics, if you go through past exam papers, you'll be good.
You'll be good.
But I'm going to upload a document with the resources that you actually need to find, as much as books for each one is concerned, because I've left out a number. Like pediatrics, you've got Baby Nelson, you've got the Blue Book. What else you got?
The Red Book.
And there's also Xeno. Xeno has all four. Xeno medicine, Xeno surgery, Xeno pediatrics, Xeno obs and gynae. But Xeno was more useful when I was going for rotations. You don't want to look,
it's like a lot of content.
And read a lot of unnecessary things on DKA only to be asked something that was in the book that you actually went through. So Xeno helps you, like for your ward rounds, you'll be well prepared, you'll be wearing something firm, you'll be able to respond to certain questions and look like you're actually serious about life.
No, it's true.
And then if you want to go deeper, like you will not find your answers like maybe most of the exam answers from Xeno, but Xeno will make you warm enough to just enter the ward round with a bit of confidence.
Yeah, that's great. You gotta have a little bit of confidence. Oh, but I have one last question to ask. I'll direct this to my boss, Dr. Tari. You're my boss, right?
Oh my goodness.
So a lot of people have been asking me this question: is orientation worth it? Should I go for orientation, or should I just start at home and then just sit for the examination? What do you suggest?
Well, that is controversial. Controversial in the sense that there are people with testimonies that I actually know. They came to them, just studied from home, went for the exam and passed.
Big time.
But I feel like it's important for you to go through the orientation program, depending on when you actually come back to Zim and when you plan on writing your exam. For example, if you come back to Zim in July and you think it's too late for you to sit for an exam in October, so you're going to write the next year in March, and that whole time you're going to be sitting, you're going to forget a lot of things that you actually knew before you came back. So going for orientation will not only keep that information you came from medical school with alive within you, but you actually get to reinforce the things that are important here.
Reinforcement.
Yes, and that is important. I remember like in Cuba, we didn't have a lot of HIV patients or TB patients. But when I came here, internal medicine, I've lost count of how many TB and HIV patients I would see. In Cuba, I only met 3 people with HIV, for example.
I've never seen HIV in China, imagine.
You see, look at that. So there is no way we're going to have the treatment of HIV at our fingertips. But now if you go for orientation, you actually know like which regimen is working and what are the side effects of a certain regimen. For example, if they tell you an HIV patient who now has kidney failure, you know like, okay, this is a side effect of tenofovir, you see? But you get to know that if you've actually been in the hospital and watching patients that actually come in with kidney failure and they're saying it's, tenofovir-induced kidney failure. And then you know that. And then when you get that in the exam, you don't have to crack your head much, even if you probably didn't read it. Because when you go through HIV, maybe you just read the medications and not focus too much on certain things. So I think, going to the hospital for orientation, it helps in that setting. And it also helps your practical skills. If you didn't get an opportunity to put cannulas, do certain practical things, you get a logbook with procedures that you're supposed to do. Of course, you still probably learn some of them when you become an intern, but it's just good practice to actually get to do some of these things, and yeah. And
that will make your life easier actually when you actually learn the procedures during orientation. When you become like an intern, actually, it's going to be quite easy for you. Like, you know your way around, you know how to put a cannula, you know how to to do some small procedures, like to make your way quite more efficient. Because when you start, like, for the most part, think about the confusion that you had when you started orientation. You don't know how to put a cannula, you don't know what to do to a patient. Just imagine now you're now like the intern that you're supposed to do stuff. So yeah, so in short, I found the orientation program useful. Other people just studied and passed straight up. My secret to you is that if you come back, let's say for example you're still a medical student, but if you come back in July, try to write in October. The sooner you attempt, the better, because you still have some memory. So you probably may not go for orientation, but if you take that time to actually study hard,
using past papers and getting in touch with people that have actually done these exams, joining those study groups, you've got a high percentage of passing. And then if you write in March, it will still work out. But if you've been sitting since July to March and you are thinking of studying alone at home, and at home you don't study every day because you get sent somewhere, you're chilling with friends, and then you have all these things, distractions. And lack of motivation. I don't know when I started studying. I think I started studying in December when I started my orientation. Before that, I wanted to, I would think about studying, but you just have a lot of things like, where do I even start? And
there was no push.
Yeah, I just didn't have that. And then someone says, come, let's go somewhere. Even if I had planned to study, I would definitely go. I was like, okay, I'll do this later. So please do sign up for orientation and actually commit to just going there for 4 hours. I think it's around 4 hours, depending on which rotation you're in. 8 to around 12 for one most. And at most, so it depends on when you're actually writing. My advice is, the earlier you write, the better. So some guys go to Tanzania, do a year of internship, then they come back. So when they write in March, it's not so far from, having when they've finished, because some finish in November, December, things like that. So they can easily pass as well without going through the whole 6 months. So my advice to you is, if you're gonna write late, like way later after you've left medical school, it's very good for you to be in orientation program. But if you write ASAP, you might not even get the chance to get into the orientation program. But do get in touch with people that actually know about the topics, and get past papers, because past papers will make your life so much easier.
I think that's gonna be it.
So see you guys in our next video. Hopefully you found this very useful. Please do feel free to like, comment, and subscribe. Do share this with other people that you know that may benefit from this. Thank you. Bye.
Goodbye.